Rapaflo, also known as Silodosin, is used by men to treat the symptoms of an enlarged prostate, also known as benign prostatic hyperplasia, BPH. It does not shrink the prostate, but it works by relaxing the muscles in the prostate and the bladder. This helps to relieve symptoms of BPH such as difficulty in beginning the flow of urine, weak stream, and the need to urinate often or urgently, including during the middle of the night. Rapaflo belongs to a class of drugs known as alpha blockers. It is important to note that you should not use this medication to treat high blood pressure. The recommended daily dosage of Rapaflo is typically 8 mg once daily, and it is best to take it with a meal at the same time each day. When taking Rapaflo, it is important to follow your doctor's instructions. Typically, you will take this medication once daily with a meal. If you have trouble swallowing the capsule, you can sprinkle the contents onto a small amount of cool, soft applesauce and swallow it right away. Remember not to chew the mixture and do not save it for later use. After taking the medication, drink a glass of cool water. It's important to be aware that Rapaflo may cause a sudden drop in blood pressure, leading to dizziness or fainting. This risk is higher when you first start taking the medication, when your dose is increased, or if you restart treatment after stopping. To minimize this risk, your doctor may advise you to take your first dose with food at bedtime to allow your body to adjust to the effects. The dosage of Rapaflo will be determined based on your medical condition and how you respond to the treatment. It's important to take the medication regularly to experience the most benefits. To help you remember, take it with the same meal each day. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Rapaflo include dizziness, lightheadedness, and ejaculation problems. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, it's recommended to get up slowly when transitioning from a sitting or lying position. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to notify your doctor right away if you experience any serious side effects, such as fainting. In rare cases, males may experience a painful or prolonged erection lasting 4 hours or more. If this occurs, it's crucial to stop using the medication and seek immediate medical help to avoid permanent problems. Although a serious allergic reaction to this medication is rare, it's important to seek immediate medical help if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects not mentioned. If you reside in the U.S., you may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Rapaflo, it's important to discuss any allergies you may have with your doctor or pharmacist. It's also important to let them know about your medical history, including kidney disease, liver disease, low blood pressure, and certain eye problems. Rapaflo may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. Before undergoing any surgery, including cataract or glaucoma eye surgery, make sure to inform your doctor or dentist if you are taking or have ever taken Rapaflo, and let them know about all the other products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Rapaflo, especially dizziness and low blood pressure when getting up from a sitting or lying position. These side effects can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of using Rapaflo with your doctor. It's also unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Rapaflo, it's important to be aware of potential drug interactions. This means that other medications or supplements you may be taking could affect how Rapaflo works in your body. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes both prescription and non-prescription drugs, as well as any herbal products. Some products that may interact with Rapaflo include other alpha blocker drugs, such as prazosin and terazosin. Additionally, if you are taking a drug to treat erectile dysfunction or pulmonary hypertension, such as sildenafil or tadalafil, there is a risk that your blood pressure may become too low, leading to dizziness or fainting. Your doctor may need to adjust your medications to minimize this risk. It's also important to be aware that other medications can affect the removal of Rapaflo from your body, which may impact how the medication works. Examples of these medications include adagrasib, azole antifungals, clarithromycin, cobicistat, cyclosporin, HIV protease inhibitors, mifepristone, ribociclib, ritonavir, and others. Be sure to discuss any potential interactions with your doctor before starting or stopping any medications. If someone has taken too much Rapaflo and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include severe dizziness and fainting. Now let's talk about the daily dosage and optimal timing for taking Rapaflo. The usual recommended dose is 8 mg once daily with a meal. It's best to take Rapaflo at the same time each day. This will help you remember to take it and will ensure that the medication is working effectively. Remember, always follow your doctor's instructions regarding the dosage and timing of Rapaflo. It is important not to share Rapaflo with others. While taking this medication, it is necessary to undergo lab and/or medical tests such as prostate exams and blood pressure checks. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Rapaflo, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. When storing Rapaflo, it's important to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom, and be sure to keep it out of reach of children and pets. It's also important to not flush Rapaflo down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of Rapaflo. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.